Ashley Bartholomew is a former operating room nurse who was redeployed to the ICU when the OR closed down. She was caring for some of the sickest patients and recently had to make the very difficult decision to quit her job as a nurse. And Ashley Bartholomew, she joins me now. And Ashley, you wrote on Twitter about this conversation with the patient who thought COVID was nothing more than a flu and thought some of the coverage about it was fake news. And you wrote, quote, and it's a lengthy quote. I want to read it for our viewers and our listeners on Sirius Satellite Radio because it really does capture the sentiment. I make a choice, something I've never done. I say, to be honest, this is my last shift. You're the only patient of 25 that has been able to speak to me today or is even aware I'm here. He's surprised but doubtful and asks if other people are doing as well as him. I tell him, I've never seen so many people so very sick. He asks if a lot of people have died. I'm brutally honest. I tell him in 10 years of being a nurse, I've done more CPR and seen more people die in the last 2 weeks than I have in my entire career combined. What made you want to share that candid assessment, Ashley?
I was so shocked in the moment when he was saying this to me. It was truly shocking. Like I said in the thread, here I was basically wrapped in a tarp is what I say. And he's in a COVID ICU and he's still kind of denying the severity of the situation.
This particular moment that you shared was your breaking point. What was it about this moment?
I wouldn't say that it was my breaking point. I had actually planned to resign. We're a military family and we'll be relocating. And I actually stayed a couple more weeks to help specifically in the COVID ICU. But this moment was just, it showed me the power of denial and how misinformation and disinformation is killing us. And it made me, not nervous for not only this one patient. If he's thinking like this, there's potentially thousands or millions more, and we're in trouble if that's the case.
But these folks who were in disbelief as you were helping them or trying to help them heal, how would they explain their own symptoms? How are they explaining what they were themselves dealing with in the hospital?
I'm not even sure, other than what he kind of explained to me that, he felt like it was just really not more than a flu. And I think kind of when I showed him, explained to him just how horrible the previous 2 weeks had been for me and, just met him on kind of like a human level. I think he started to really realize that, how severe everything was.
You think it set in with him? What happened to him? Is he better? Is he out?
So I had the opportunity to transfer him to a lower level of care. He's being transferred out of the ICU. And, that's when he kind of said, when he saw the other patients and kind of the busyness of the unit, he told me, no, I was mistaken. This is a lot more than just a flu. I didn't realize that I was kind of the exception. And so I wished him well. And, nurses and healthcare providers, we're tired. We have family of our own that we're trying to protect, and the work and the hours and the acuity of the patients. It's grueling, tiring work. And so, do what we can to help us, help you.
It's taken a toll. I can only imagine. It's had to have taken quite the toll mentally and emotionally on so many nurses and doctors in this country over the last 9 months. Do you think you'll get back into the profession once you move?
Yeah, absolutely. I have had a lifetime of service. I love being a nurse. I plan to do graduate school at some point. And after we move and get settled and get the kids settled, I'll definitely jump back in and be at the bedside.
Not to put you on the spot here, but we've been covering this now for the better part of 8 months, 9 months now, I think, at least. Is there anything else that journalists, media can do to help folks understand the severity of COVID?
I mean, I think, thankfully, the media seems to be doing a good job, like exactly what you're doing. It's hard, though, when we have these mixed messages from a national level down to a state level, and then even here in El Paso at the local level. Those type of mixed messages get mixed results. And unfortunately, in healthcare and in a pandemic, that means more sickness and more dying. And that's frustrating for us. And we need to get hold of that so that we're all on board for a vaccine and we don't run into these same types of problems when we have our one glimmer of hope.
And it probably doesn't help that you got a bunch of folks reading a bunch of wacky stuff on the internet and sharing all that nonsense, too. Ashley Bartholomew. Ashley, thank you for your service. Happy Thanksgiving.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.